everyone. My name is Gayana. I'm gonna cover today chapter 8, which is about mental disorder. So first though, I will talk about a number of popular beliefs about mental disorder, and then so examine the number of social forces behind mental disorder. Then we talk about the various types of mental disorder, analyze of series of societal responses to the problem, and see how different psychiatrists and sociologists view or explain mental disorder. Mental disorder is surrounded by many myths, such as the mentally ill are extremely worried. Mental disorder is hopeless, mostly incurable. A sharp difference exists between mentally ill and mentally healthy, normally healthy. People are likely to be depressed in a coldness or winter. Nowadays, older people are more likely depressed than younger people suffer from depression. In the United States, today, mentally ill criminals are more likely to be sent to a mental institution than to a prison. There are types of mental disorders. In psychiatry, there are two opposing views on what constitutes mental disorder. First, biomedical, second, psychological. The former consists of mental illnesses similar to physical disease, and the latter sees it as an emotional problem of psychological origin. Psychiatrists have adapted to biomedical view, which has become accepted in a manual published by the American Psychiatric Association. The second view, which is less popular today, is the mental disorder are psychoanalytic or emotional problems that are psychological in origin. So there are two types of classification of mental disorder. First type is traditional, and the second type is DSM fourth classification. There are two broad types of traditional classification. First, organic, and the second one is functional. Organic disorder is caused by damage to the brain, which in turn may have originated from the tumor, head injury, brain syphilis, lead poisoning. Functional disorder, on the other hand, is believed to result from psychological and social factors such as unpleasant childhood experience, interpersonal conflict, or social stress. Functional disorders are further divided into three types. First, psychosis, second, neurosis, and the third one, personality disorder. Psychosis is more serious than other disorders. So it involves a loss of touch with reality. Neurosis is less severe than poiesis, and there are three types of neurosis. One type of neurosis is an anxiety reaction. Second type neurosis is combination of obsession and compulsion. And the third type is depressive reaction, which is characterized by a feeling of sadness, rejection, or self-depression, decreation. So on the third one, personality disorder is a general category for virtually all sorts of deviant behavior that the psychiatrist can think of but cannot diagnose as either psychotic or neurotic. And the second type of classification is DSM-4, which is Diagnostic and Statistical Manual of Mental Disorders. Over 300 mental disorders can now be found in the DSM-4, and each has a list of systems that enables the psychiatrist to determine the mental disorder and then collect money from insurance companies. So many patients get relief from symptoms because doctors can use DSM for to prescribe appropriate medications. Now we're going to talk about the social factors in mental disorder. Psychologists have long discovered the influence of social factors on mental disorders, and the more important factors are social class, gender, young age, a social profile of depressive teens, race and ethnicity, or urban environment, and PTSD, post-traumatic stress disorder. The lower cases have higher rates of mental disorder than other classes. Women are more likely to suffer from depression and anxiety, and men from antisocial personality and drug and alcohol abuse disorders. Young people today are more likely than older persons to have psychological problems, particularly depression. They suffer from major depression, which with such symptoms as extreme sadness and difficulty sleeping. They are overwhelmed with stressful events but lack social sources which deal with them. Puerto Ricanas and African Americans are more likely to have sociopathic and paranoid tendencies, and Jewish and Asian Americans tend more to suffer from depressive disorders. Urban areas have higher rates of mental illness in general than to rural areas. And urbanities also tend more to suffer from neurotic and personality disorders, but ruralities tend more to experience severe depression. And finally, there is a growing number of war veterans with PTSD, but less than half of them seek treatment. Now we're going to talk about the global perspective of mental disorder. Cultural forces can determine rates and symptoms of mental disorders. Modern society's culture of competitiveness and individualism differs from traditional agricultural society and promotes more mental disorders. Types of mental illness vary from culture to culture. In Latin America, people experience a fear that their souls have left their bodies, while in Malaysia, people suffer from prolonged screaming and swearing than starlit. Symptoms also mirror to culture in which they take place. In developing countries, depression is more likely to appear in somatic and psychical symptoms, and compulsive disorders take different forms. Similarities among all societies include the fact that women are more likely than men to suffer from anxiety and depression. Men are more likely to have alcohol disorders, and young people are more likely than older ones to have mental disorders. Um, the next is societal responses on mental disorder. In the past, the mentally ill were believed to be possessed with the devil, and so were sometimes burned alive. By the mid 17th century, they were chained or otherwise treated like animals. Today, the treatment of the mentally ill is no longer barbaric but remains unpleasant. Here are how various parts of society respond to mental illness. First, the public. Public still often believes that the mentally ill are dangerous, dirty, and worthless, even though they are treated with more tolerance than before. Second, the court. Court also treats that mentally ill in negative ways by putting them away in mental institutions or prisons. So first, involuntary commitment, denying rights, and instant defense. Uh, instant defense. And the third one is a mental hospital. Mental hospitals are total institutions where patients are cut off from the larger society and laid in closed um, so many states institutions have especially bad situations, including little respect for patients, dirty words, gang showering, sexual abuse of female patients, and the employment of incompetent psychiatrists. And the fourth one is the community mental health centers. Community mental health centers provide local care for the emotionally distributed and utilize the resources of courts, police departments, and welfare agencies to keep them functioning. Um, the unprofessional treatment provided by a network of family and friends called network therapy has proven highly effective in bringing the institutionalized person back to normal life, which is great. Um, and lastly, I want to talk about the perspectives on mental disorders. There are three different ways of looking at the mental disorder. First is medical model. The medical model sees mental illness as similar to physical disease in that its causes are biological and can be treated in the same way as a physical disease. Supporters refer to twin studies to show genetic causes of mental illness and also use the success of drugs in treating mental patients to argue that problems come from a chemical imbalance in the brain. Second one is psychosocial model. Psychosocial model has two versions: the psychoanalytic theory and the social stress theory. Psychoanalytic theory, it's a Freud's theory, so which focuses on conflicts in personality. Um, the idea is governed by the pleasure principle and is in conflict with the ego and the reality principle, or the superego places moral restrictions on the idea. When resolved conflicts occur in patients' childhood, they lead to later symptoms such as anxiety, depressions, and compulsion. Second is social stress theory. Social stress theory sees stress as a major contributor to the development of mental disorder. Divorce, unemployment, death of a loved one, certain jobs are seen as major events leading to stress. Um, Third model is labeling model. Followers of the labeling model believe that mental disorder is not a sickness but only a label imposed upon some distributing behaviors. Um, Mental illness as a myth. And the impact of labeling. There are two types for mental illness as a myth. Thomas Scass has sharply criticized the medical model for assuming that mental illness is just as real and objective as a bodily disease. The behavior exists, but the label distorts the behavior, which is really a problem in living. Moral conflict, or a communication expressing some socially unacceptable idea. And Thomas Scheff also sees mental illness as a myth and an ambitious label. Mental illness is a category for residual rule breaking, which includes the worst kinds of rule violations that society does not clearly define as rule breaking. When labeled, persons are led to develop stabilized chronic mental disorder. The label is the most important factor in turning a person into a chronic mental patient. Third one is insanity as supersanity. Lang sees insanity as supersanity and criticize psychiatrists for seeing their patients' experiences as somehow unreal, invalid, or false. He feels patients are actually oriented to inner spaces and time, while the psychiatrist is oriented to outer space and time. And the last one, criticism of labeling model. Advocates of the medical model have criticized the labeling model by arguing that mental illness is not a myth but real behavior that exists everyone, and that mental hospitals do not victimize most persons labeled mentally ill. Thank you very much.